This podcast is sponsored by Pax. Whether on the water, on land, or in the air, Pax bags are both versatile and flexible backpacks that are perfectly suitable for your requirements in the most demanding of environments. Pax bags are highly regarded due to their exceptional performance in pre-hospital and in critical care environments. Their well-organized compartments and customizable configurations enhance efficiency in high-stress situations. They're designed with infection control in mind and are easy to clean and disinfect. So highly visible colours and reflective strips aid quick identification and adherence to quality standards, ensuring reliability. So the versatility of Pax bags caters to diverse EMS providers, and they deliver vital equipment, durability and ease of use for pre-hospital critical care services globally. I've used Pax bags in a number of critical care situations, and they're absolutely excellent, both in identification of kit, but also in identification of the reflective strips to ensure visibility. So please see the show notes for further details.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. In this episode, we're going to be speaking about navigating mental health in leadership with Marc Watson. So Marc is a highly accomplished pharmaceutical physician and mental health advocate. So his career has spanned frontline medicine as a GP, then into senior leadership in pharmaceuticals and global medical affairs. Fundamentally, and something we really want to dive into in this podcast, is Marc's personal journey, one of navigating his own mental health, namely a diagnosis of bipolar. So we're going to look at his transition really from clinical medicine into the pharmaceutical industry, also the emotional weight of making high stakes decisions in both environments actually, but also the strategies he's developed to manage, balance, and really acknowledge his own mental health journey. Marc, welcome to the podcast.
Thanks for having me. It's really good to be here.
Marc, I just wondered, just for listeners, if you could just maybe just unpack your journey for us, really, from being a GP into the pharmaceutical medicine, and also maybe what inspired the transition.
Yeah, as you know, I sort of qualified from medical school 2003, so sort of quite a long time ago now. Sort of, it's a bit depressing how long ago it was, but down in Southampton. I think originally I had sort of these lofty ambitions to be a heart surgeon. I think a lot of people do. But after doing my sort of junior doctor years and working in hospitals, which was really quite challenging, I started out with a view to become a surgeon. And then after the sort of completing the training, I kind of realized I wanted a little bit more of a work-life balance. So I moved into general practice. And so I was in the NHS for 10 years, and for kind of 6.5, so the majority, I was a GP down on the south coast of England. And there were parts of that I enjoyed, but I think the one sort of consistent sort of thread throughout that whole time was I was just so ill all the time. And I didn't have any real kind of insight as to what was going on at the time. I just was really struggling. There were aspects of the job that I really enjoyed. I really liked sort of seeing patients. I come from a kind of really working class background, and I was always able to sort of translate that and be a sort of, have a good bedside manner, I guess people would call it, and sort of really relate to people. Even though I apparently have developed quite a posh voice since moving away from Kent over the last 20 odd years. But I was able to sort of connect with people, and I really enjoyed that part. But throughout the whole journey, that's 10 years in the NHS, I was constantly off sick. I was really, really struggling to cope. I was drinking too much. So, you'd sort of often find yourself working with a massive hangover, and sort of your decision making could be impaired because I just had I had no mental sort of foothold in the world really. And I didn't really know what it was. I was kind of diagnosed with depression, anxiety, which later on, I'm sure we'll talk about, transpires isn't really a diagnosis. And it was just really, really difficult. And I think it kind of came to a head really in about 2013. I was working kind of in various salary GP jobs around the South Coast. And I just wasn't able to consistently apply myself. So I was calling in sick kind of on the day. I'm quite happy to sort of accept my accountability in that, and that's not good when you're in general practice because there's no one else to do your job. It's quite a lonely environment, general practice, in some ways, because you've not got the team like on a hospital environment that can kind of cover for you. So letting patients down on the day who'd obviously waited sort of weeks to see a GP And I just was so unhappy. It was really, that was really the kind of consistent thing. If I look back now, just really being unhappy, despite loving being a doctor and wanting to use it, it was really, really difficult. Um, and I would like to sort of think that there was some great sort of plan in me transitioning into the pharmaceutical industry, but really there wasn't. So I think it was May 2013, and it was probably a couple of years too late. I sort of made a decision that I had to move, had to do something else, basically. And I really didn't know what. And I think I found a website which was alternative careers for doctors. And there was like I kind of can visualize it in my head now. It was like these little tiles. There was about 9 tiles on this website landing page. And there were different things like being a lawyer, kind of, which would have, and other jobs which would have required retraining. But there was something about working in the pharmaceutical industry. And I thought, well, I don't really know what this is about. But what it will mean is I can utilize my training that I've got, which I'm proud of, and I really want to sort of stay in some way, sort of stay in medicine. Um, and then I sort of contacted an agency, and I really sort of lucked out, to be honest, because I got a job in pharmacovigilance, which is basically the science and sort of practice of monitoring safety of drugs after they've been released onto the market, in a managerial position. So it was quite unusual. Most doctors have to come in at sort of an entry level, like sort of skipped a step. And the company really invested in people. So they sort of made that decision to invest and sort of help me train. And I really never looked back. And I honestly didn't really know what the job was at the time, and subsequently found out what it was. But it's been sort of a really positive step. Although, I still continued for several years with mental health issues, which I'm sure we'll elaborate on. Um, but I think in terms of how it's kind of changed my perspective of patient care, the thing that I really love about working in the pharmaceutical industry as a physician is just the scale of the difference that you can make. So there's a bit of a trade-off. You lose that sort of intimacy of helping individual patients and seeing your individual patients kind of get better, or you're helping them in their own sort of problems. So you lose that, of course. But what you are able to do is to sort of ensure really high quality sort of care and medicines on a kind of population level. And there's some really big decisions, and I really like kind of making those kind of decisions and being involved in that, because I think that's where physicians can bring a lot into the industry. Um, so yeah, it's really kind of a fabulous job, and I've really kind of enjoyed retraining as a pharmaceutical physician and being able to make a difference.
Yeah, indeed, indeed. And we'll unpack the mental health piece, because it's absolutely fascinating. And the genesis of this interview really was listening to you actually on another podcast, which we'll put in the show notes, around the grind diaries with a mutual friend of ours who is fantastic. It was a fantastic insight for me, and really transparent. So we'll do a deep dive really into your mental health. But just before we do, could I get you to speak to, because there is a pressure in both environments. Like you said, candidly, as a GP, you've got 10 minutes to see patients. You've got a
Mm.
huge patient workload, or population in your clinic every day, and there's pressure there. But there's also pressure from the pharmaceutical industry, I think, probably around patient safety and around making sure that the drugs are having a positive benefit rather than a negative one. Could I get you to speak to how you approach stress in both environments? Because there is applied pressure, but it's just a different type of pressure. But could I get you to speak to that?
Yeah, I mean, I think the first half of my career, I didn't cope with pressure. I think that's probably fair to say. So I think it's a really, really difficult environment. Like working in clinical practice is super difficult. It's much, much more stressful than it now than it was when I left. And I kind of feel that there's probably not the support that there really needs to be for kind of doctors and other kind of healthcare professionals working in the NHS. And it becomes really quite a lonely existence. And therefore, you kind of have to have really good individual and personal kind of coping strategies, which I didn't really have at the time, because I just didn't have any stability in my mental health to even sort of get those things in place. I think if there was one thing that I did that probably helped a little bit, was I've always really been into exercise. And that's always been something that's helped me kind of personally, but it was just not quite enough to tip the sort of scales at that point in my career. I think in in the industry, I have found it a much more kind of supportive environment. I think there are kind of some companies that are probably more supportive than others, but ultimately you are kind of a part of this kind of healthcare partnership, and pharmaceutical companies really should be seen as, or should be acting in a caring manner, because this is about kind of helping people, including the staff. Um, so I've had really quite a lot of support, and companies really do kind of provide quite a lot of individual support. But I think the other ways that I've kind of coped with some of the high pressure environment is, one, I'm very well trained. So I don't think a lot of people know, but pharmaceutical medicine is a subspecialty of medicine, a specific specialty, which has its own sort of training and qualifications. Um, so I'm a specialist pharmaceutical physician, like a surgeon would be a specialist kind of, and trained to be a surgeon. And within that, you're trained on, a big thread that goes through pharmaceutical medicine training is ethics. So because that's what we can bring into the industry, is that kind of experience with patients, applied ethics into every situation, um, and that sort of knowledge that, which again I don't think is very well understood, and sometimes kind of people find controversial, is that patient care nowadays is a partnership. It's not just about the clinician. It's not just about pharma. It's basically a partnership, and it cannot operate in isolation. And that's one of the jobs that we have to do, is to try and sort of make that work. Because I think a lot of people understand how drugs are made. They get kind of, they know clinical trials. They know, like, when the point where the doctor kind of prescribes it to them, but they don't understand the bit in between and then the bit after. And that's the kind of part where pharmaceutical industry comes in. Um, and then just the final piece on how I've kind of coped with some of those pressures, because there are pressures sometimes, because it's a commercial environment. It's really kind of going back to the purpose of what you're doing. So um, really having kind of a clear understanding of the purpose here is about improving patients' health and putting the patient first. So the decisions that I have to make, I'm always kind of comfortable I've made them, even if sometimes, they might not be what other people agree with. You just have to be really confident that that's the right decision, and believe in your why and your purpose. Um, but it's a really sort of good, kind of honest, transparent kind of environment to have those discussions. And sometimes there are really big decisions, because you're making kind of decisions on a population level, not an individual patient level. So it is challenging, but I think certainly sort of having those things in mind can really help with those big decisions, especially in a stressful environment.
Could I get you to speak to really some pivotal moments for you that led you to, I want to say sort of thrive instead of survive, but like not even that, just cope really, and look in certain terms, just to really manage and indeed acknowledge your mental health.
Yeah, I think there probably are one or two sort of pivotal moments. I mean, the first was diagnosis, which came very, very late for me. So um, just as a brief kind of backstory to it, I'd struggled for probably since I was about sort of 14, 15, really didn't know how to deal with my emotions, um, and was kind of, yeah, I guess, a complex kind of child. Even though I was kind of performing well at school, I was kind of, emotionally quite complicated. Um, and then I sort of got diagnosed with depression, which again is not really a diagnosis, to be honest, when I was in my first year at medical school. Um, and I'd been on for, I guess, from that point, which was 2000, no, it was 1998, up until 2019, when I was diagnosed with bipolar. I'd been through all of the, pretty much every antidepressant known to man. Um, I kind of almost drove this kind of misdiagnosis to an extent, because I'm a doctor. I'd go in to see my doctor and I'd say, I've got depression and anxiety. I'm not feeling good. What can we do? Maybe we should try this medicine. And there was no objectivity, and that was kind of driven partly by me. So the big moment really was kind of 2019, where I was really, I'd been in the industry for 6 years, had a good first few years, and then sort of this kind of problem started coming back, and I was kind of off sick again, sort of fairly frequently, working at GSK at the time, which who were very, very supportive as a company, which was good. And I just made a sort of contract with myself that I'm never going to make anything of my life here, never going to get where I want to be from a career perspective. And I'd sort of made a decision that I was going to kill myself. I hadn't really made any plans at that point, but I thought, look, I've got no kind of hope here at all. So I made a bit of a contract that I go and see a consultant for one last time to see if there was anything else that they could do for me. And I just got lucky, really. I Googled, you know, best psychiatrist Harley Street sort of difficult depression, and I basically landed with this consultant called Andy Zamar, and he has really saved my life, and that's not an exaggeration, completely. So that I walked into that room. I didn't really know, sort of had no expectations that I had bipolar. I'd never even considered it. Like I never even sort of crossed my mind. And within sort of a minute, he just looked at me and said, "I'll tell you how you're feeling." And he just explained exactly what my brain had been like for the last 20 odd years, and that internal agitation and turmoil. Um, and he said, "The reason why you're like this is because you've got bipolar disorder and you've never been diagnosed with it. In fact, the treatments you've had have made you worse, and I'm going to make you better." And from that point forward, I was completely in his care. I felt like a patient, and he's just an absolute genius of a man, and just yeah, I can't thank him enough, really. Um, so that was really one of the big moments, and I think sometimes a diagnosis can be a positive or a negative thing. For me, it was the best sort of moment in my life to date, really. So because it had validated kind of the last 20 years of how I'd been, and some of those times when I called in sick and let people down, or kind of let family down and things like that. It at least um, there was a reason. I'm not saying it wasn't just me being an idiot, but there was definitely an underlying kind of sort of reason there. So that was a really big moment. Um, I think another couple of things, really, just the being open about my mental health and speaking out on things like this. And I've done a few kind of um, podcasts now, in different environments. And prior to that, I'd been quite active on sort of social media, just posting about kind of, and never been afraid to say that I was ill. That's been very, very therapeutic for me, personally. I know it's not easy for everybody. So that's quite an important part, and I think has been helpful for me, sort of getting from kind of surviving to thriving. And then I think the final thing I would say is, despite sort of having the diagnosis and the bipolar being under control, I had a lot of emotional problems from sort of my perception of my childhood and my trauma, complex trauma, which was on top of kind of having a severe mental illness. And I think about 18 months ago, I sort of really felt this was the time to start to deal with that. So I've had sort of a year of really quite intense therapy, and it was probably the hardest period of my life, to be honest. When people say, it's going to get worse before it gets better, by God, they mean it. And but weirdly, I came out through the most difficult period of my life dealing with this, and it was almost like a switch. I suddenly just felt better, and for the first time in my life, the last year, I've almost felt normal. And it's incredible how, these your kind of psyche and your kind of emotional trauma can really impact everything about you. So I would say they're the kind of really big pivotal moments, and probably the final one, the therapy, has been the biggest. Um, so yeah, I think it's sort of trying to have a holistic approach to this, because there's never like a single magic bullet that's going to kind of make you kind of better.
Yeah, no, indeed, actually, and that's powerful, Mark, in a way, because, like you said, it's this a certain level of acknowledgement, and then, like you said, just understanding maybe some of the origin of where this is coming from. Could I get you to speak to maybe how you've managed? Because I firmly agree with you. Actually, I think from an acknowledgement of a diagnosis, and a correct diagnosis, it helps you to manage. It gives you maybe even a roadmap as to how to even consider managing the diagnosis. Could I get you to speak to how you've managed it beyond the diagnosis, and indeed, yeah, whether that's been a successful journey, how that's looked beyond diagnosis?
I've kind of done a lot of reflection. So I think for me, kind of reflecting on things has always been very, very powerful, either just by myself or um, with kind of therapy, therapy sessions. So I think that's been really, really helpful in trying to approach my life in a different way and sort of manage sort of the bipolar, manage my life around the bipolar sort of beyond the diagnosis. Um, I think I've got a really good sort of way of compartmentalizing aspects of my life. So some people find that very difficult, and everybody's different, but I'm able to compartmentalize sort of aspects of my life, say that the things that maybe aren't going so well, and then the things that are going really well, and reflect on those. Um, so I've got some really amazing things sort of going on in my life, and when you're in a sort of period of stability with your mental health, you can really kind of leverage those. And thinking about kind of those above the negatives is really important. So I've got an amazing kind of job. I'm doing very well in the sort of profession because I'm working for the faculty, so the Faculty of Pharmaceutical Medicine, who oversee the training and kind of the standards and essentially the profession of pharmaceutical medicine. I'm now kind of involved on a board level there, so I'm giving back. So I find that really therapeutic, and not being sort of just keeping it to myself, um, and just sort of really sort of taking in being active in the moment. So I live in a really beautiful part of London in Richmond, and sort of just taking in, you know, I never thought I'd ever end up living in Richmond, when I was kind of a little kid in sort of Kent. So taking those positives has been sort of a, a really good kind of mechanism beyond diagnosis. And then I think you have to have also some more practical kind of coping skills. So I think building resilience is really important. Sometimes resilience, unfortunately, is something that kind of it just happens to you through all the negatives. But it's beneficial if you can try and build some resilience and some strategies to be resilient. So I have a very practical kind of way through a company called Think Productive, who I met sort of nearly 10 years ago, of managing my workload and my work-life balance. That's incredibly important. I never think about work when I stop work, which I'm really in a minority there, I have to say. But this process and this kind of system allowed me to do that. And then I try and get to the gym as much as possible, and I'm enjoying that. And I can't sort of speak enough to how much exercise can really make a difference in your kind of mental well-being beyond diagnosis. So yeah, there are a bit of a rambling answer, but I think you just have to be flexible, and you have to kind of find ways to sort of cope and really kind of go from surviving to thriving, I think.
Yeah, indeed. No, indeed. And to your point around exercise, it certainly helped me on that
Mm.
journey.
Yeah.
After a critical care paramedic myself, and I would just really help. Just I think something you said there about unwinding and learning to just process, unwind, and disengage. Actually, disengage your brain. And the beauty of exercise is the immediacy of it. If
Mm.
it's painful, and or you can't think about too much else because you've got to focus on it forces you to focus on the here and
Yeah.
now, and I think there's a real simplicity and beauty in that, actually. But Mark, just looking one step further, really, around, because you've said this already, and I think it's fantastic that you are such an advocate for mental health, and actually, I think that your transparency and honesty is so refreshing, and even I can identify certain elements of my journey in that. But could I get you to speak to really the challenges you faced in discussing your experiences? Maybe if others were in similar positions, is there any advice you give to other people around being as open and honest as you've been?
Yeah, it's really, really difficult to sort of give people advice on this, I think, but I can speak to my kind of experience and maybe some pointers. But you are, unfortunately, sort of when you are open, you do have to kind of take into the context of the environment you're in. Um, and I think I've always been very open. I've always been sort of probably a bit of an oversharer. And so it's never been a challenge personally for me to kind of open up, which is unfortunately is a problem for a lot of people, and they do find it very difficult. I think there are two parts to it. One is the personal aspect. So I think, I can only sort of encourage people to sort of try to talk to somebody and find somebody in the environment they're in that will listen, because nobody wants you to feel rubbish. Like absolutely no one wants that. And if they do, then they're not worth your time. but most people really don't want you to feel kind of ill. And I think some people, when you're feeling really kind of ill and you have mental health issues, you think you're a burden on other people, and that's one of the reasons why people don't want to open up, or they feel embarrassed and there's a stigma. But most people that you talk to will kind of embrace you, and I think that's something I can encourage. But obviously, I think you do have to kind of assess the environment you're in. So in the kind of professional environment, I've been very lucky because the companies that I've worked for have been very, very supportive. And I think more so the managers that I've had have been really good people. And I think I'm lucky, because that's not everyone's experience. I'm a medic. The vast majority of my managers have been healthcare professionals. Um, and so I am lucky in that respect. But I think it is important to sort of try to find someone you can talk to and be open. Um, and if people kind of push back, I think it's kind of reasonable to challenge. And sometimes that's easier if you've got a friend or a kind of someone who's supporting you to sort of say, well, why have you reacted that badly to someone who's really just trying to get some help? Um, and then I think the role of kind of advocates, and I've really tried to sort of in my company be an advocate. I've spoken on World Mental Health Day to sort of the company before, um, just to sort of normalize that this is really normal for people. There's so many of us that go through struggles, and I think that kind of helps people to sort of feel in a safe environment. But companies do have a responsibility, and I think we're going to talk a bit about that. But in actually bringing in sort of mechanisms within the companies and sort of workplace environment to actually support people is really important.
Yeah, let's go there actually, because I think like you said, it's really important actually, because I think, and maybe you can speak to this, is around when you speak up and speak out, what you realize is there's probably 10, 15, 20, 50 more people feeling
Yeah.
similar to you actually, which haven't spoken out. So there's this actually unlocks a lot of people's struggles when they actually see someone being actually
Yeah.
really honest and open. Could I get you to, as a senior leader within the organization now, within the pharmaceutical industry, could I get you to speak to maybe your thoughts, Mark, about how you create a culture of openness and indeed support around mental health, I guess in a way just to help other people uh, become open and be able to share.
Yeah, it's really important that sort of companies kind of have this what is now called ESG. So it's kind of this environment, sort of environment, sustainability, and governance, and that's becoming a big thing. So companies now have legal responsibilities to actually um, think about sustainability in the broadest possible sense, and that includes kind of employee well-being. So there are the companies that I've worked for, they have the first thing is they need to try and build a positive culture, because without that, really, it's very, very difficult for people to sort of feel that they belong and they sort of open up. So I've worked some good companies that build a good positive culture, which is about the people. So that's really important. Um, there are kind of mechanisms in a lot of companies now, which I can only sort of encourage all companies to follow in having employee kind of well-being services. So, I have sort of healthcare insurance, but they're also kind of access to sort of talking therapies, for example. And I think that's really, really important. But also, I think companies really do need, and I encourage this, really need to sort of give managers and their employees the capabilities to be able to help people, to recognize when someone might be struggling, but also just to be able to listen. Um, I've done a little bit of work recently with a faculty with Samaritans around active listening, and I think that's something that companies could really encourage, especially managers, to embrace and actually become more skilled in order to be able to help people. Um, And I think then again, just going back to sort of people with, it needs to be constantly on the agenda. Wellness is not something you can just pick up once a year on World Mental Health Day. And I think that's where it does get a little bit more challenging. In my experience, you've got to try to find people who are going to push that agenda. And you really need people in role in company who are doing that. It can't just be the side job of somebody else. So the best companies I've worked for have had people in role who actually are, specifically looking at kind of well-being, mindfulness, things like that. So there are lots of strategies that can help, and I think it's about senior leaders really sort of pushing for that.
Yeah, indeed, absolutely. But and just pivoting slightly and just looking at, so one of the aspects, and you've notioned towards this already in the interview, Mark, is, and I've certainly found this within pre-hospital care, and even now, actually, I still find this is actually some of the really big decisions, and I'm going to flip this back to you in a second, is around sharing the mental model, sharing the load of the decision, certainly when it
Mm,
was a cardiac arrest or indeed a critical care patient, which was maybe, not going the way we wanted it to go, but actually understanding that the burden of decision making and responsibility actually
mhm,
could be shared and actually probably should be shared either on scene with colleagues and maybe even a reach back to a clinician in the background just to share the burden, share the responsibility, and also just cross check my decisions so that I understood that we were coming to the right
yeah.
decision. I realized when I didn't do that, and there was a few times I didn't, and it kind of really impinged on my own mental health and my own
Mm,
anxiety sometimes. And thought I actually need to really share some of these decisions, like for my own mental health, but also for the team and for the patient. Could I get you to speak to just that sharing that burden, even now, because now you have a huge responsibility for patient safety and otherwise. Could I get you to sort of share how you make decisions and share that mental model with the wider team?
Yeah, I think you're absolutely right. I kind of, while you were talking, I was kind of remembering kind of some of the things that really impacted me when I was a junior doctor and the lack of support that there was. I remember when I worked in A&E, it was my first sort of job after house jobs in Bournemouth, and it was a non-trauma centre, but we used to get the odd trauma in, and it was just not set up for it. And I remember the sort of highs and lows. I remember a chap who came in who was kind of bleeding out from a kind of stabbing, and we saved his life like there and then. And like you just can't get any closer to sort of actually saving someone's life. And I couldn't sleep for days because I was on such a high. And then the flip side, we lost, a baby, and it was the sort of atmosphere in that sort of hospital for days was just the the complete opposite. And losing people. I remember the worst thing that I experienced, which will always live with me, is sort of having a failed cardiac arrest from a motorcycle accident. And while we were trying to revive the chap, his mobile phone was going off in his pocket, and it was obviously his family kind of wondering why he hadn't come home. And that still makes me feel a bit emotional. And there was no support whatsoever. And I think you're absolutely right. You need to be able to kind of debrief. You need to sort of be able to share that sort of that decision making responsibility. Moving it to kind of what I do now, I think actually for the most part we're really good at that sort of in the pharmaceutical industry. There are obviously areas for improvement, but we do work as a team. And as a manager and leader, I kind of make sure that I have my team's back. I trust them. As long as this decision has been made for the right reasons, I will kind of have their back, and it's a shared responsibility. If you make a decision, which is quite, often happens in industry, they're not all kind of life or death, but you might make the wrong decision. But if you made it for the right reasons, that's something that you should celebrate and you should kind of debrief on. So we try to build a culture of um, learning from failures. So kind of debriefing on things and really learning from failures, because that's the only way that you grow. And also failing fast and failing forward. So you really need to sort of put the things behind you, learn from them, and then make improvements. And I do think that there is a better environment for that, and sort of we do kind of take collective responsibility. And there's nothing worse than sort of feeling bad, except for feeling bad and feeling alone. So if you kind of have a supportive environment and share that sort of responsibility, it can make all the difference, I think. So yeah, I would definitely agree with you there.
So, Mark, with your experiences in rare diseases and indeed pediatric oncology, could I get you to speak to, because I mean, that diagnosis alone carries such a burden of mental health for families and indeed those experiencing and going through pediatric cancer. Could I get you to speak to the mental health considerations that could be integrated, I guess, in a way better into patient care and that patient care experience for the support and for the support of families, really.
Yeah, it's an amazing kind of field to work in. I've been sort of associated in, with pediatric oncology for the last 4 years approximately, um, in my kind of my current role. And it's an area where it's it's the most emotive thing that you can think of, isn't it? So a child who hasn't had a chance to live their life gets this kind of life-altering diagnosis. There pretty much isn't anyone in the world who won't have an emotional reaction to that. And that can be difficult, but it also, for us as a company and individuals, it's incredibly motivating. Like people will go the extra mile to make a difference. And I've found it's such a kind of, you have this North Star that you're trying to make a difference for these children. And people really kind of get behind it. So it's amazing. We've kind of obviously we work with the doctors treating kind of pediatric oncology, and we also work with patient organizations, which has probably been one of the most rewarding things in my career, working with patient organizations. And these organizations are often charities. They're not part of the NHS. They're set up to support individual families with different diagnoses. And we work with one in the UK who've been absolutely fantastic. Um, and that just sort of listening to the experience of these families, you just feel their kind of how how mentally challenging it is. And it's not just for the child, it's for the siblings, it's for the family, everybody involved. It completely changes their life, and the treatment is really brutal. So I think that there absolutely has to be kind of really sort of good mental health support, not just for sort of the children, but their families as well. Um, I think there probably does need to be an investment in this in sort of the clinical environment for sure. And that's sometimes where pharmaceutical industry can help actually, because we can kind of do sort of collaborative work and support sort of services within kind of healthcare. But the other thing that I've found has been what my experience so far, the biggest kind of support that these families have is with the patient organizations. The support that they give to the families from a mental health and kind of practical perspective is really incredible, and they deserve a huge amount of credit. And I think, as I mentioned right at the beginning, kind of treating patients is a partnership. As pharmaceutical companies working in that area, we have a responsibility not just to sort of sell our medicines, but to actually make a difference. And we will advocate in the strongest possible terms for support for patient groups, and we will support them where we can and build partnerships because they provide such an amazing kind of service for um, supporting families in mental health. Um, and hopefully, I think the bit that probably is the gap is what happens later on. So survivorship is a big thing now with as these children, you know, get survive, which is fantastic. The majority of them survive, which is incredible. When they become adults, they're left with a lot of kind of trauma. And that bit I think is kind of underinvested in. So that's an area where we collectively have a responsibility to do more, I think.
So, just as we're coming to land, actually, a couple more questions, Mark. One would be really, I guess, in a way, looking back on your career, is there a moment and or lesson, Mark, that really profoundly changed your approach to mental health, both, I guess, in a way, personally or professionally?
Yeah, I think I was sort of reflecting on this a bit, and I, th I think there was a really important moment which I hadn't really sort of realized, and I think it's again a little bit about that passive resilience that just happened to me, and how resilient humans really are. I think um, I'd obviously made a conscious decision that I couldn't carry on sort of treating patients on the front line with my the problems I had at the time, which were obviously undiagnosed. And I think that was looking back, that was a really important decision because I would have probably made a mistake, or I would have kind of done something that adversely impacted me and patients. So I think that was a really important decision that I made. And it took a while to get there, but I'm really proud that I made that decision. And it subsequently turned out for the best, but I'm not sure it was by design. It was probably more by luck. Um, and then I think again, just going back to you know a lesson that uh, another lesson when we talked about it a bit already, but having kind of therapy has been so huge for me. Like and could only encourage people if they have the resource to sort of have therapy and they can find a way of getting therapy, to sort of go there. It's a bit of a journey in itself because I think I probably had several kind of therapists, and I just eventually found the one that was right for me, and who understood my problems. But I think there's a lot to be said for it, even when you don't necessarily have mental health issues, because we all have stresses in our lives. And I think, one thing the Americans do well is that everyone has a therapist. And I think that's good because you're able to reflect your life and you're able to kind of understand kind of how you're behaving, and just kind of have someone an outlet to sort of talk to. So these are sort of some of the things that I think have been really kind of important for me personally, and I'm a big advocate of.
Yeah, yeah, indeed. No, indeed. And just absolutely. And I agree more actually. And I've also accessed therapy. And the only way I can describe it really was kind of pulling the plug on a bath or a bath full of water. And it actually was this really, I was more relief than anything.
Mm,
I'm not sure. I felt, you know, anything else but relief, and just a weight off my shoulders that I could process things with someone. And actually sometimes just the active listening piece, other times
mm,
reiteration of message, and sometimes to your earlier point about when you had your formal diagnosis, it's about someone speaking, giving someone permission to speak into your life in a really consistent and honest and helpful way.
mm.
For me, that was powerful, and I just felt anything, nothing else but just this overwhelming sense of a weight off my
Yeah.
shoulders, and it was like life changing, actually.
Yeah, I think there have been probably, I know we've touched on a few of them, but there have been three moments in my life, I think, where I felt that almost kind of literal weight off my shoulder. One was, from a professional perspective, was that mechanism I mentioned earlier. So think productive system to managing kind of productivity and work-life balance was all over the place. I went into that course, a one-day course, all over the place, very kind of cynical, not receptive, and came out of that course with the weight of the world lifted off my shoulders, and have never ever worried about work-life balance ever again since then. The second one was my diagnosis, and then the third one was definitely sort of getting through that therapy and feeling like I now understood myself more than anything, and you know it wasn't my fault basically. So yeah, I know what that feeling feels like, and it's pretty kind of nice.
Yeah, that's powerful. That's powerful. Just finally, Mark, as we come into land, just if I could just get your thoughts really on either one or a couple of key messages really about mental health within healthcare, and for healthcare professionals, particularly in high stress environments. If there's a message you'd like to give, what would it be?
Yeah, because it is so stressful. I feel kind of privileged that it's easier, I think, in my kind of industry, because we are making high sort of stakes decisions, but it's not the same as being the SHO in Portsmouth on a surgical take, which, and sometimes that's good actually to sort of, when you're feeling stressed, to actually reflect back where you've been before and what you coped with. But I've still got friends in the NHS who I just feel for them so much. But there are probably sort of two things I think that are really important for people in that environment. Um, the most important thing is to get help when you need it, and um, there will always be somebody you can talk to. It might not be your employer, it might not be your friend, it might be a therapist, it might be your GP, but it's going to be one of those for everybody. There's going to be somebody that you can open up to, and often that's the first step. Just you feel like you're alone in this kind of cocoon, and just being able to kind of articulate it and share it with somebody, it's the first step, and I cannot recommend that enough. That's always the first thing I say: get help. And I think the second thing is, trying to sort of proactively build kind of strategies for resilience. It's really easier said than done because we're all busy, but if I had my time again, I'd sort of probably do put more effort into that. Um, and it's something that it's kind of landed with me because we do a lot of that kind of within the industry, but it's definitely another thing that I'd recommend.
Yeah, indeed. And just to your earlier points about this journey of self-discovery, because I think, as you were saying before, one thing that might work for someone may not work as well for someone else,
Hmm.
but it is finding the thing that works well for you. And but listen, it's just fantastic just to go through the last 45 minutes with you, Mark. Just that your story and indeed anecdotal reflections through your organic journey has been powerful just to understand and listen to, and hopefully it helps other people understand that actually we're not really designed to do this on our own, and that we should we should really involve other people, especially within healthcare. But thank you for your time. It's been really powerful just listening to you.
No, it's fantastic to have had the conversation. And again, I sort of really count these discussions as part of my individual journey. They've always been helpful for me just to reflect and sort of hear how it lands with other people and what their experience is. So thank you for having me on.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.